Very nice to meet you, and I think possibly one of your greatest discoveries was that people with CFS have low blood volume. So my doctor right here, and he sent me to Pasadena, and sure enough I had low blood volume.
Do you remember how much?
My doctor told me I have about 1/3 less blood than a normal person.
Okay, so you have 67% of a normal circulating blood volume.
Right.
And that's about the number that I've seen a lot. Do you know what happens if you are a healthy person and you lose 1/3 of your blood volume in a car accident? You croak. You're in shock, but then you croak. A normal person can't lose that much volume all at once and stay alive, actually. 25% is about the limit. So the number is correct. What they measured, I assume they did it with the chromium-15.
Right, the radiation. Now, they told me that the test was developed for people who have too much blood.
That's right.
And then they actually have to bleed people.
That's right.
Now, I'm not really, I am so sick all the time. Usually a lot of times if I can even check my mail, I'm doing good in a day. My mailbox is just in front of my house. That's how tired I am every day. It's like I'm anemic.
Right.
But it's like, even though I have low blood volume, that's been established, my CBCs always come out perfect.
Yes.
So how could that be?
Good question. And it's, I'll tell you a story before we get into the answer of that question. We have a local ER. My wife used to run the ER, and she knows the doctor I'm talking about. He's a wonderful guy, but he knows that this chronic fatigue nonsense is just taking up his time. He needs real disease, like somebody who's got an arm cut off. I mean, that's what he likes. Patients with chronic fatigue syndrome come into the ER, he just rolls his eyes. He says, oh my God, get that person out of here. But he's very smart. He's a very bright guy. So I went into the ER one morning, and I went up to him and I said, hey, Sam, look at this. I got a patient here and this is the blood volume studies that we did, and this patient has only 2/3 of normal circulating blood volume. He looked at it and he groaned, holy smokes, he was really impressed. I said, you kicked her out of the ER last night. And he did. I mean, that's why I went in to talk to him. Our friendship didn't go so well after that. Okay, so what happens is that there is a decrease in the circulating blood volume. For about 5 years after that finding was, and that's been confirmed now by an NIH study down in Miami and a couple of other places. So I think that this is for real. 80% of patients will have a low circulating blood volume. And it's significantly low, like what you're talking about. If somebody comes in with a 10% reduction of blood volume, which is what happens to astronauts, they have a hard time. There was a press conference recently, the astronaut fainted at this press conference because she had 10% reduction. So what happens is, if you look at all of the mechanisms to maintain circulatory blood volume, antidiuretic hormone, there are 3 or 4 regular mechanisms. They all work fine. So how could it be that you have only a 67% blood volume and your ADH is okay and so on? It turns out that the answer must be systemic vasoconstriction, so that your pipes are constricted so that when you measure all of the blood in your body thinks that 2/3 is okay. But this is not going to circulate blood up into your brain well at all. My personal feeling, and this is a bias that I have, is that many of the symptoms of this illness are vascular. So that if you were able to normalize blood flow through the brain, many of the symptoms would be much better. That pre-syncopal fatigue and so on. Unfortunately, I don't know how to do that. We've been messing around with intravenous saline, and for some people that will give them a significant lift, but it's not a good long-term treatment. But I think that the vascular aspects of it are due to systemic vasoconstriction, and the best candidate I could come up with for that would be the isoprostanes. Isoprostanes are intense vasoconstrictors which are put out when the body is having severe oxidative stress. So that when your cells are under oxidative stress, the isoprostanes come out, vasoconstriction, less oxygen actually gets to the cells to cause more oxidative stress. But I don't know any simple way to correct that.
But don't you think that could be the cause of chronic fatigue if people are walking around with 30% less blood? I mean, that would cause you to be fatigued.
It does, but it's also possible to correct that. Give them a blood transfusion, bring it up to 100%.
Yeah, that's what I'm saying. It's like if they're bleeding people, why don't they give me some of their blood? Like, I'll take my chance.
Because it doesn't work.
It doesn't work?
Temporarily, it makes you feel a little bit better.
For how long?
A week, 2 weeks.
I'd take a week or 2 weeks.
This is why I wouldn't give it to anybody, because they would want it on a repeated basis. Now, I have a book that's on my website. It's free. And one of the chapters in there is about a patient who had her blood volume tested. It was about 60% normal. She went into the ER throwing up blood. She had been taking too much ibuprofen. And then they gave her a couple of bags of normal saline. It diluted her blood out enough so that her hematocrit was low. They gave her blood transfusions. She felt wonderful for a couple of weeks. And she was able, through the hematologist, to get blood transfusions after that. She felt much better with the blood transfusions. This is not an acceptable treatment in my mind, because...
But if it makes someone feel better when they feel like they're going to die, I mean, if they're feeling like they're dying every day, even if they have 2 good weeks, don't you think it's worth it? I do.
You know what? There are times that and I thought about this. There are 2 papers in the medical literature that argue exactly what you're arguing. If somebody has idiopathic hypovolemia, which is what you have, and that's an old term, why not give them blood transfusions? And so this was argued in the medical literature. However, in today's day and age, you won't find any physician who will do that. Maybe a hematologist will. So, sorry, even though that may make you feel better, and it might be worth it, you're not going to get it from any physician who's licensed. Black market blood transfusions, I don't think I do.
So you don't see any treatment for low blood volume?
Well, you can make the blood volume come back to normal with other ways.
Which is saline? You said saline?
Well, saline is one, antidiuretic hormone, and there are but it doesn't work very well.
I'm sorry,
ADH.
ADH?
I'm sorry if I'm putting you in a problem, but it doesn't work. We treated about 25 people with ADH, and we were able to get their blood volume up, but they didn't feel enough better. And also 20% of the more severe chronic fatigue had normal blood volume. So that while I think it's important in the symptoms for a lot of people, it's not the answer.
So the most severe of the chronic fatigue had normal blood?
Yes, yeah, in general.